Content warning. This podcast episode contains discussions of a sensitive nature that may be triggering for some individuals.
5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. I'm so happy to be back with a new episode after taking a break. Today, we're focusing on a special topic that many of us face: navigating the Christmas season with resilience and hope. I'm thrilled to have a very special guest from Hampshire, England, lead counsellor from Kidney Care UK, Jackie Pilcher. Jackie has been a counsellor for 20 years and has worked with Kidney Care UK for 7 years. Jackie joins me today to discuss how to find hope and strength during the holiday season, even when things feel tough. So let's get started on this journey of finding hope and navigating the Christmas season with resilience. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Jackie?
I'm doing good, Dee. How are you?
I'm good. I'm really good. I'm really excited about our interview today. Listeners, I don't know if you've actually seen, but I've spoken with Jackie before when I recorded some quick Meet the Team episodes, which are on YouTube. Do check them out, where I speak with different members of the Kidney Care UK team. And I spoke with Jackie about the counselling department of Kidney Care UK and the amazing work that you do. And I know it's amazing because I personally accessed the service when I was first diagnosed myself. So I myself have benefited from that service. And yeah, I want to take this time to applaud the work that you do because it really is important and helps so many people. So from the bottom of my heart, and behalf of anybody else who has used your service, I want to say a massive thank you.
Thanks for that, Dee. That's lovely. And we have a really dedicated and great team. Thank you.
So the topic of our episode today is finding hope, navigating the Christmas season with resilience. Now, for some, the Christmas season can be a difficult time. And so I really wanted to record a podcast episode that was encouraging and uplifting and focused on hope. So without further ado, I'm going to ask my first question. And my first question is, the Christmas holiday season can be a challenging time for many, especially those dealing with chronic illness. From your perspective, what are some key factors that contribute to this, and how can we start to address them?
Oh, thanks, Dee. Good question. Firstly, just as a general, I think there's such high expectations with Christmas. And I did hear the song on the radio the other day that I think you'll all know well, that it's the most wonderful time of the year. I'm quite curious who wrote that, actually, because for many, I feel it can be the most stressful and a lot of pressure. And I think especially dealing with kidney disease, with chronic illness, that multiplies enormously. So I'm going to blame Hollywood a bit there for these perfect Christmases.
Yes.
And I would say, I think one way of dealing with it is to be kind and realistic with ourselves about what our limits are, what we can do, what we can expect, what's realistic in the whole thing, rather than this idea of perfection we go in or recapturing younger years or years past. Just actually dealing with where we are here and now and looking at what we can do rather than what we can't do. I think that's a quite important part to consider, because sometimes we can get so focused on what we can't do now that we lose sight of what we can do, or even what we want to do rather than what we should do. I think should be banned. The word should is very detrimental. So it's about, do I want to do this? Do I want to visit someone? Do I want to join in with this or that? Or do I really prefer not to? And that's okay too. Giving permission to yourself to be able to do what you feel able.
I think the permission thing is really important because, like, for me personally, in my journey as a kidney warrior and how my life has changed so dramatically from what I used to do compared to what I do now, there was a long time that I put pressure on myself to do things as I always did. Like, for example, I used to train 4 times a week, and I put a lot of pressure on myself to get back to that and to keep that. This is me and this is part of who I am, and I've got to keep going no matter what. And ended up pushing myself too far, and I came to the point where I was like, I just cannot keep this up anymore. I can't do what I used to do, and it's okay. I had to give myself permission to say, I'm different now, my life is different now, and that is okay. I think especially at Christmas, where everybody's kind of tuned in at the same time to the same thing, there's more pressure because there's so many people, and it's like, yeah, this is how we always used to do it, so this must continue. And actually, no, my life is different now. I have to do things differently, and it's okay.
Yeah, acceptance. I think that's a huge part of it, rather than, I'm going to say something right corny now as well, but I like the analogy of it. It's thinking like an oak tree is very strong and quite unyielding, actually, but quite likely to be toppled in a storm. Whereas a willow, which might look more weak and willowy, for want of a better word, but that will bend with the storm and is likely to remain standing. And sometimes I think it is, from what you've just described, Dee, it's realizing when we need to bend, when we need to yield, when we need to allow ourselves doing things differently. But, and also having spoken to many clients, I think it's so evident that with kidney disease and chronic illness that we can kind of struggle, we can kind of lose our identities of who we are. And what I heard you then was reaccepting yourself, reaccepting your identity, because sometimes we're told, oh, you're still you. Yeah, you've got kidney disease and you're still you. And there's a lot of people thinking, I'm not me. This isn't me. And I understand that. And I take that and I agree. But it's coming round to adapt. Actually, I am still me. But behaviours, challenges, things are different. But it's okay. I can work with this. Because when we're trying to recapture things that aren't there anymore, that can bring very low mood, if you see what I mean, and we're focusing on the wrong aspects. So it's great, the example you just gave, Dee, because it kind of frees you, if you like, to move from that place of sort of a false hope.
So just looking at that a bit more in terms of false hope, how do people move away from false hope? And actually, maybe we need to start with a definition in terms of that. When we say false hope, what do you mean by that?
I suppose my interpretation is, and if I use an example, I do use a lot of examples because I think it often explains things, but it can be sometimes that kidney patients may be told, here's an example, yes, you've got early diagnosis kidney disease, but you don't need to worry about that. Yeah, don't even worry about that at the moment. You know, you're not at a level where you're needing dialysis or whatever, and you almost can feel a bit, go away, just don't worry about it. And some people, like, it could be just 18 months down the line, it could be 6 months. Equally, it could be 10 years, but I'm saying it's an unknown. And they're being told they need dialysis. And it's a bit of a shock to the system, because actually the false hope, what they were told was, you don't really need to worry. And so it's giving false ideas rather than saying, we can't say exactly, because we all know how uncertain kidney disease is. So even if it's explained in a way that, look, this is really uncertain and this could happen and that could happen, but at the moment, you're in a good place and it's about living healthy and, hopefully you've got a long while before you might need dialysis, but we don't know for definite. I think that's the thing, because people can feel very angry. That's a false hope if they're told, don't worry for 10 years. Equally, as I've said, it might be 10 years. If you're told that and it's not, you've just been given a false hope. Equally, people, for instance, with transplants, it's like transplant is a total fix. Anything you're suffering with, when you get a transplant, it's all going to go away. That's a false hope, if you like. So I think dealing with false hope is about being realistic. If you've got a heart condition, underlying condition, having a kidney transplanted isn't going to take away underlying health conditions, but it will, hopefully, the kidney disease will be able to be in check. But it's those sorts of things, false hope, or you'll get through this, you'll be 100%. Don't worry about dialysis. It's just a normal life. It's not. It's not. So those are false hopes, but you can manage kidney disease around life. That's what the aim is, rather than managing your life around the kidney disease. So you try and look at the aspects of what you can manage. But I think keeping realistic and people being realistic with you, come to this party, you're going to be fine. I know you get tired normally. You'll be okay. Don't worry, you don't need a break. That's a false, that's not realistic, and then people feel guilty like they're not managing. So I think it's that kind of thing.
So when it comes to the people around the kidney patient, so the family, the friends, the loved ones, in terms of false hope, then I think they are also key in that understanding from what you just said. Mm-hmm. Like you said, come along, you'll be all right. And giving the person the false hope that they will be. So I think it's really important that the people around the person also understand that concept too, so that they don't inadvertently put a lot of pressure on that person and then they end up going and then feeling horrible and not enjoying anything because they knew they weren't going to have the energy to attend that party in the first place.
Yes, I think absolutely. And I think then there's a guilt with it. Like, I didn't live up to what was expected of me, or I made it bad for everybody, having to put a false smile on the whole time. So I think it's kind of, the thing is, say the party's going to be 4 hours, for argument's sake. You don't want to exclude people totally. I'm not saying that. I'm saying you'd encourage, but even saying, come for half an hour and see how that is. Have things in place that if they needed to retreat back to their quiet place, they can. They've got an out, if you like, rather than being forced into a situation where, well, I'm here now, I can't ask anyone for a lift, they're having a drink, this feels bad. If you're encouraging someone to do something, try and have a plan B as well, so that they can retreat without feeling they're ruining it for everybody. But equally, I think it's good for kidney patients, chronic illness, to try to do things. But if it's shorter term, that's fine. Or saying, I can come for an hour, but I'd need a rest after an hour. Is there a place where I could have a breakaway and then you might want to rejoin or not? It's looking for flexibility, really, rather than rigid options.
I think that's really important that you have that. You don't feel as bad about it then. It's like you can still maintain some autonomy and control, even in a situation where you don't have full autonomy and control.
Yes, I absolutely agree. And I also think sometimes it's a case of saying, we're not going to keep asking if you're all right. You tell us, because there's nothing worse, is there, than being the focal part gathering, where are you okay? Are you all right? Did you need a chipstick? Do you need a napkin? It can be, It can make you feel invalided. So it's almost having that grown up, adult to adult. If you're not all right, you just give me a wave and we can sort something, but not being constantly checked on like that, because you can feel the patient and that's not a comfortable place most of the time.
And on the flip side to that, if you were the person that every year you were the one that hosted the party. You were the one that hosted the dinners at Christmas time. And then, you've gone into kidney failure and you don't have the energy to do all of that work. How does somebody who's used to being the life and soul of the party or the head of the party or the organizer of the party, how do they come to terms with the fact that they can no longer do that?
I think that's a really hard one. It's really difficult for people to accept that. So it's not a simple, oh yeah, that's okay. But I really think it's about seeing what they've done so far. That was great. Like, you might have been able to run a mile in a short time when you were younger. You might not be able to do that when you're older. It's just accepting sometimes you can't do as much as you used to do, but also seeing that it's lovely to pass that over to somebody else to do that. You're not dumping on them. You've done it. You've enjoyed doing it. Even if you didn't enjoy doing it, it's definitely time to pass the mantle over and give yourself permission that perhaps a new tradition is that you actually don't do anything Christmas Day because you've paid your dues. You've done your bit, and to watch other people doing that. And there's still ways you can interact if you want to. You could be passing on your recipes or, giving tips or stuff like that. It doesn't mean you've got to totally withdraw and be no part of it, but you don't have to take the full responsibility anymore. And equally, you could take no responsibility. That's okay too. You can be a guest.
Put your feet up and relax.
Yeah, enjoy. Yeah. Otherwise, you can you're going into the martyr system, to be honest. And that can be quite not a great trait to be in. It's almost, no, I have to cook this, I have to do that. And then, the next week, you're absolutely rough and everybody's got to run around and look after you because you've done too much or you're feeling sorry for yourself. So actually take it that there's choices, and choices can be difficult. But there are choices. Do you want to do it? Do you not want to do it? Is it realistic? Yeah.
I have a saying that if you don't give your body the rest it needs, it takes it anyway, and it doesn't do it nicely. So I always say to people, listen to your body, take the rest as you need. And for people who, like I said, are used to being the one in charge, it can be very difficult. But what's more difficult, not taking that rest or ending up in hospital? Or worse.
That is such a good point, Dee. It's absolutely right. Your body is often trying to tell you and you're ignoring it, so it really is that, isn't it? It's feeling, and there can be, it's that huge fatigue that can come with kidney disease and chronic illness that people sometimes describe as tiredness, but it isn't tiredness. It's fatigue. It's a whole different thing. And if you're in the middle of hosting something and then that overtakes you, you just feel dreadful. So think beforehand what you are going to do, what's realistic and what's not, But you're quite right. Otherwise, it will show on your body and, it will take it out of you.
Now, you mentioned about traditions, new traditions. So actually, let's talk a little bit about that. So can you suggest ways to create new traditions that can bring comfort?
Yeah, that's a good question, isn't it? And I think new traditions is always good. We get a bit stuck and hung up on traditions, don't we? That we do, even if we're doing it with gritted teeth. This is a tradition. We've always done it, But everybody's thinking, I don't know why we're doing this, So it's rethinking traditions. I think the first one, giving over chores that you've done for years, is a good tradition and can give you comfort that you're entitled to do that.
I like that.
I think I think we could all take that. There'll be no dinner. We'll all be doing what apparently it's a big deal in Japanese, isn't it? It's the most Christmas dinner is Kentucky Fried Chicken. So perhaps we'll all be doing that if everybody gives up.
There are other outlets that provide chicken, no free advertisement.
Oh, sorry. Yeah, I haven't got shares in them. Yes. So there's that. But I think also it's like thinking for some people, going to somebody else's house can just all be too much. They might just want to chill in their own environment, not make a big deal because it's Christmas Day. You've got to get up with baubles on your head and whistling and dancing. So they might want time in their own space, but it could be nice perhaps even to interact in a Zoom call that you've arranged. That could be just a chat, or it could be a quiz, it could be a game or something you could interact with family or friends. I think that could be a nice tradition to do, because then you're not entirely on your own. You're doing something that the people will like that as well, but you don't have to go and stay somewhere for overnight or something if that's not what you feel like doing. And that's okay. That's okay too.
I think that definitely helps take pressure off if you don't have to leave your home, and you can leave a Zoom call quite easily if you need to. Again, other providers, no free advertisement on the podcast. Here we go. But ultimately, just the act of having to get ready, get dressed, leave the home, drive to somewhere can be a lot of pressure within itself. So something that you can do from your own home, but yet still not miss out on that interaction with others, sounds like a really good idea to take that pressure off people's shoulders.
I think so. I think also putting time restrictions, if people really want to visit you, that can be nice, but it could be good to ahead of time think of how long you'd feel you could cope with that, because some people can come. Once again, you're kind of out of control. You don't know what time they're people talk about hosting parties, don't they? It's meant to be for a couple of hours, a little gathering, and you've still got people at midnight. But equally, if someone comes to your house, being kind, because it's difficult for you to go out and about, but equally they might stay too long. So beforehand, actually set the time so that you can get on and have your chill time for whatever you want to do, rather than be at the mercy of people coming, going when they want to. So some of it is about controlling what you can in a good way that looks after you best.
So I think it comes back to how the people around the kidney patient can be supportive. So let's talk a bit more about that. So how can the listeners, how can the loved ones, the family, the friends support their person who has kidney disease during this season?
I actually think the listeners, as you're calling it, or the people around, can feel quite useless, quite guilty, have hang-ups themselves about it all. It's quite difficult. I think never underestimate that just being there or just listening is how huge that is. And when we're talking about listening, it's really listening. If somebody's really saying they don't want to go, and they're not looking for you to just cajole them into, oh, come on. It's really listening to what that person's needs are, and perhaps even discussing with them how best to sort it. Do they really not want to come at all? Do they really not want to see anyone at all? Or would a half hour or an hour or a phone call be a nice thing? Sometimes as well, it's learning that as a listener, that person, the other person, isn't asking you to fix them. They just need to perhaps have a vent or an explanation of what it's like for them, what they're missing. I think as well, it's a time when Christmas, people overindulge. People on dialysis can't do that. It's very strict what they can eat, their fluids and everything. And I think as well, it's being aware of that and not trying to, this won't hurt you, that won't hurt you. If a person's making their decision, just go with that. It's just normal. It's okay. If somebody's on antibiotics, they wouldn't drink alcohol, generally speaking, and you wouldn't encourage them to. So I think it's just about encouraging. If there's any special foods you could get that's nice, it's a different thing, but not trying to talk somebody out of it or over sympathizing, because it is what it is. So perhaps playing it down just a little bit, but just being there to listen is really quite an important role. And you are helping by just doing that.
My mind goes on to people who have very young children. So for very young children, full of energy, really excited time, they're opening their presents, all different things. And their parent, the person with kidney disease, doesn't have that level of energy. What strategies or advice do you have for somebody that has very young children, full of energy, and they're not?
So one thing to just consider, it's not a total solution, but it's a different way to look at it and to remove some guilt or whatever, that I've spoken with many clients sometimes about naming the kidney disease so that you're taking it away from you as a person. So somebody I worked with a long while ago had a tumour that they named so that the tumour, I won't say the name actually on air, but let's just say it was called Charlie. Let's just say that. And it became that Charlie was the problem. Charlie couldn't quite cope with going to the beach or couldn't cope with staying up too late. So rather than the parent feeling so guilty, it's like, Mummy's tired, Daddy's tired, Mummy can't do this. It's another thing, Daddy can't do it. It's like Charlie's playing up. So it's like we can all get a bit cross with Charlie, whereas it's very mixed emotionally and psychologically to get cross with a parent who's ill, or for the parent to get cross with themselves as well. So taking it out of the body and almost saying, yeah, Charlie's playing up, but I'm going to give it a break for a minute because he's being awkward, but we're joining. So it's something that the family can use with a bit of humour. And it's not so, oh, Mummy's tired, Mummy's this, Mummy's that, because children get responding with that. I think as well with high energy, it's thinking of things, perhaps games, reading, different things that you might be able to interact with them that don't take so much energy. And that's where perhaps asking other members of family or friends that they can do that. It doesn't have to be on Christmas Day, but it can be, oh, so-and-so is going to take you, I don't know if they've got a bike or something, going to do that then, because it's high excitement. But if you prepare, they can know that might happen a different day. It might happen Boxing Day or the week after or something. But really, it's so important to not do more than you can manage and to ask them joining in. Even little children are happy to do things for you, to join in. It's like we're a team. Let's all do some bits here. That can help. But on a psychological basis, I think it's not beating yourself up for it. You're doing good. You're doing the best you can. It's not that, oh, I'm a useless parent, I'm letting everybody down. Don't go there. Because if you can, I know I'm just going, don't go there like it's simple. But if you can really try and avoid those sorts of thoughts, because they do emanate into the room and it brings a low thought. So check your thoughts. Check what's going on in your head throughout the Christmas period. Are you beating yourself up? Because actually the kidney disease and the world generally at times is quite willing to do that for you. You don't have to join in, so resist it. And perhaps, the mantra, I'm doing the best I can at this moment in time, and believe that. Or even if you don't believe it, just say it, because it's much better than you beating yourself up. I'm ruining Christmas. I can't do this. I didn't get the shopping I wanted to get. This isn't right. That's wrong. My wife's upset because I'm not helping her, or my husband's upset because he's having to wait on me. Try and challenge. But before you can challenge those thoughts, you have to be aware of them. So take moments to listen to what's going on in your head, and then decide whether you need to change that voiceover with, I'm just doing the best I can.
I really like that, naming the disease. I've never actually done that. I really like the fact that you can kind of compartmentalize it in that way. And so it takes the pressure off you, and you're taking that focus away from yourself in terms of, like you said, Mommy's too tired or Daddy's too tired or whatever. It's like, yeah, in this example, no offense to anyone named Charlie, but in this example only, Charlie's the problem. I really, really like that.
I think as well that, in families, not necessarily with children, sometimes when it's a couple, and I've worked with one member of the couple, it can get quite antagonistic where both partners are tired of the disease, whether they've got it, not got it, but they're walking on eggshells because you don't want to say, oh, I wished you could come for a Christmas walk. I wished we could go and visit so-and-so, because it's like you're beating the person up with the disease, or the person who hasn't got the disease is like, I don't know why you're suggesting we need to go there. We don't need to, and it gets quite clashy. And I say at times like that, if you can name the kidney that's a problem, the disease that's a problem, I say sometimes think of it sitting on settee with its feet up, watching you both bickering, and it's having a lovely time stirring it all up. I think of that and think you're making it bigger. You're giving it more power. Whereas if you're like, actually, I'm not listening to Charlie right now, I'm not going to give him the time of day, it shrinks him down. It makes it smaller. And you can talk about it then, because there's so many partners that can't talk about the disease because it seems personal to their loved one. And most of the grief and the anger and everything is around that this is someone you love. You don't want to hurt them on both sides, whether it's the person who's the listener or the person who's got the disease. You don't want to hurt one another. So it doesn't get spoken about because it looks like blame. So actually name it, put it out over there, watch it on the settee, just stirring it all up and identify it. And then you can go like, I am really sick of Charlie today. You can both say it, and hopefully no one's there called Charlie at that time. Please pick your names appropriately, but it will relieve it because you can actually say it. Otherwise, you're going round with this, it's okay, I don't mind, it's fine. And all the anger's kind of there, boiling underneath. Because kidney disease isn't a fair disease. Chronic diseases aren't fair. There's nothing fair about them. So when things aren't fair, we do get angry. We need to express that anger in whatever way we can and not just suppress it and pretend it's not there.
So what is a healthy way to express anger?
I think to share those thoughts. And that's where I'm saying if the disease is named, if you think of an example of, I want the footstool, but I've asked you to do 100 things for me already. You've brought me a cup of coffee. You've done this. You've done that. I'm shattered. I want the footstool. And you just sit there and you think, I'm so fed up. I haven't got the footstool. And you kind of can't say that because that's saying to the partner, get up and get it for me. I've had enough. So you kind of sit there and don't say it. Whereas if you can say, this blooming disease, I would just like you not having to run around for me so much. I would have just liked the footstool now, but I don't want to ask. I feel really angry. I feel angry, or just, I need a hug. I need you to just sit and listen, but I don't need you to do anything. I talk about counselling as the patient often likening them to, I can't say a title, like a fizzy drink. How's that? I'm not naming it. So it's like a bottle of fizzy drink. And sometimes pre-counselling, this fizzy drink can have been shook and it's fizzing away in the bottle. If you look at it on a table with another fizzy drink, they look very similar. You wouldn't know the difference. But one of them, pop, is getting ready to pop off. With counselling, we're kind of undoing that lid very gently, and a whoosh comes out. And then we tighten it again for next session. So nothing goes away. It's still there in the drink, but you're taking out the whoosh. And sometimes with one another, that's what we need to do, is just open that lid a little bit and share some of that before it's getting so fizzy and angry that it just explodes. Because we're all frightened that we're going to, not we're all, but at times we can all be frightened that we're going to boil over. If I say something now, I'm not going to be able to stop. But just think, I just need to say this and I need to do the lid up again. Sometimes even spending half an hour each or 20 minutes each with partners who are in this together, just sharing, just listening to both sides of the story. So you can sit for 20 minutes and not say anything and let the person say what they find really hard. I find it really hard that you are faffing around me and getting me drinks and offering me drinks all the time. And when I'm saying to you to sit down, you won't take a break. You're just running around trying to do everything all the time. And actually, that makes me feel really bad. Things like that. I love you. I know why you're doing it, but it makes me feel a burden. It makes me feel useless. And the other person can say, and I do feel, or might say, I do feel really useless. I really want to help you. I can't bear seeing you suffer, but I don't know what to do. Tell me what would be good. And it might just be that you want them to sit on a settee too and have a break. It might be as simple as that. So I think anger is about talking about it, really. Sometimes, well, the journal, that can feel safer. Sometimes just journaling it down can feel safer. And there might be some parts of the journal you want to share with the partner, but in the journal, you can exactly say whatever you want and use whatever language you want to do to describe it. Some people have used journals before and literally just scribbled hard in them just to get that vent out. I suppose it's just openness, being as open you can with one another and communicating that.
As I mentioned earlier, with this podcast, we're not afraid to cover more difficult topics, but always with a message of hope. And so with this in mind, what are some signs that someone might need professional help, and how can they seek it?
This obviously can vary from person to person, but some of the things as well is when people are isolating and not talking, it can be signs that they're in very low mood. We normally know people well enough to pick up that they're very low, sometimes even not wanting to talk about it, perhaps not eating properly, their self-care has gone down, there's no interest, they're withdrawing is a sign that somebody might really be struggling. I'm talking seriously, struggling here. I would say a first port of call is the GP when someone is low as this. And I do appreciate, as I'm saying that, how hard it can be to get GP appointments all over the country at the moment. But one thing I say to clients as well is sometimes it's being very clear on the phone about the need, not, oh, I need an appointment, being more specific. So if it's the person is able to contact the GP themselves, it would be saying to the receptionist, I seriously low, I'm very concerned and quite frightened at this moment, and I don't feel safe, and I really need to speak to a GP. It could also be sometimes that just walking into the surgery, if they're able to do that, and speak to the receptionist. I know receptionists get a reputation of being a guard dog, if you like, but there are humans behind that. And I think when they hear the words and someone's really struggling and I am so low and I'm just asking that I need to speak with a GP, it can be heard. And sometimes even if you're not feeling on the phone or you can't get an answer on the phone, just going into the surgery is a result. I do appreciate as well that people often say we've got a husband and wife and the wife can see this with her husband, but he's not going to go into this surgery because he's below and past that. Then perhaps the wife does that contact. I'm extremely concerned. I've got to work out how I can get him to talk to someone because he's just totally withdrawn. And that the GP could offer some support there or might give the person a ring. If you see what I mean, a lot of people, when they're really low, find it really hard to ask for help. It takes an awful lot of strength to ask for help when you're seriously low and you need it. There is also the obvious as well as the Samaritans, but many people think of that just in a case of if you're suicidal. You can be low mood without being suicidal as such. We can feel like we want to end it. What we're really asking for is help. We're not necessarily got a real plan for suicide, but we're trying to get over that we are so low. But Samaritans are there for people to talk, and they're trained and they can listen. And it might be because I could, obviously, as a counsellor, I could suggest get counselling now. There's a wait for counselling, obviously, as well. And sometimes you need something more immediate before you take that next step to counselling. So sometimes the GP, it might be antidepressants. I know people resist antidepressants, and I can understand it. But sometimes if you look at them as a stepping stone, that you're in this well and you're trying to get out, but it's really hard clawing the sides of that wall to try and climb out of it. And the antidepressants can offer a bit of a springboard, even if just for a period of time, to lift to get out, because sometimes things can seem so hopeless and so low. And remembering as well that this is the dark period of the year and we do get hit with this. And that's where Christmas can often come in as another pressure. It's just another pressure rather than a lift. One thing I was saying, I can't help but I love the 21st December because the nights start getting lighter. The days get longer by 2 minutes every day. So it's kind of holding in there, remembering those things that you're at the darkest time of the year at the moment, but it will start getting lighter gradually. And I normally count towards the spring in Mondays, not weeks, because it sounds like if you say something like, oh, we've got 10 Mondays till spring, it's much more cheery than saying it in weeks or days. But I think speaking to the Samaritan seriously is an important thing. Kidney Care, we do have a support line as well that people can contact. We don't have counsellors they can speak to immediately, unfortunately, because of the pressure and the capacity of the service. But speaking to the support line can help, speaking to your GP, speaking to Samaritans, and there are other national numbers out there that can help. But I think never underestimate what just talking to somebody can do. But equally, if you've got somebody you're concerned about, and it doesn't matter what you say, they're not going to be the ones to ring for the help, then you ring and talk it through, because don't dilute what you're going through, watching somebody suffering as well. You equally need that support to get through, because it's very, very difficult. And I hope that helps. It's kind of very difficult to advise in these situations. And obviously, if there's an extreme and immediate worry as well, it's like a 999.
So we've covered a lot during this interview in terms of strategies, in terms of listening to your body, resting, starting new traditions, giving yourself permission to do nothing at all, setting boundaries, maybe doing things online rather than face to face. We've covered a lot of different strategies, but very greedy, which is typical for this time of year. And I want even more, Jackie, even more. And, and so my final question is, what word of encouragement do you have for the listeners?
I'd say don't give up, believe, changing your thoughts. You're listening to those words and changing them, thinking about what you can control and what you can't control, and focusing on what you can control, because what you can't control isn't worth sitting ruminating on. Another one of my sayings, not my sayings, but a saying I picked up along the ways, is worrying is like rocking. It's something to do, but it doesn't get you anywhere.
I really like that one. Thank you so much for joining me. Thank you for all the strategies and advice and your encouragement that you've shared today. Thank you so much.
Thank you. Thanks for having me, and just all the very best wishes to people listening. Keep going.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast, and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.